looking at the different mechanisms we have in the health space that helps with accountability. So today's question is, what are the mechanisms in the health sector? What are the mechanisms that have been put in place by the Ilo Krobo healthcare facility or the district itself in the health sector? Because we are all stakeholders in the health space. In as much as you may be working in the health sector, you are also a Ghanaian. That means that it is the same system you also go through when you are sick. So even if you see this banner, we are asking our legislators that, is the budget allocation to the health sector really enough? Is it really enough? The number of people that are really, we know we have CHIPS compound, but then the question is, CHIPS compound really well-resourced enough to curb certain kind of issues, certain kind of ailments, that it wouldn't escalate to the regional and will not escalate to the national hospitals. Because we spend so much money at the national hospitals, and then the very basic ones that we are all supposed to, that should be our first point of call when we are sick. It is not really in any good state that we can say that it will be curbing some of these issues. Let's just say you charge me for something that insurance, NHIS, that I believe NHIS should cover. And you are saying, no, you are supposed to pay for it. How do you resolve an issue like that?
If you are having health insurance, by God's grace, we have a code for checking whether it's active or inactive. So when we check and it's active, you don't pay anything. You just pay your maintenance fee, then you proceed. Just 5 cedis. Yes, then you proceed. That is all.
The maintenance fee is paid because of the delay in reimbursement. As I'm talking to you right now, the Euro Krobo District Hospital for over 1 year now we've not been paid, raised beds by the National Health Insurance.
Okay. So that is Dr. Okoboy's ministry?
Yes. Okay. Have not been paid. And how can you run the hospital without taking money? And let me put it on records and on fact that when we came to the hospital over a year ago, we don't even have water. We don't have water running at the hospital. So these are some of the things we do to enable us buy water. If I'm not mistaken, the hospital buys about 3,000 trays worth of water almost every week. So if we are buying so much, at the end of the month, how much do we spend on just water? And if we are not taking that 5 cedis, I don't think we will be in the position to run the hospital. Like by this time, the hospital is down. Like by this time, I have 2 hospitals in Makotenefi. Yes, that is a fact. And because health insurance has not paid for almost a year, no supplier is ready to give you on credit.
People from very, very deprived communities that they can't even afford the regular 30-something cedis that we, 35 cedis that we pay, 25. Okay, so what if someone genuinely do not have that money?
Even when you come to the facility, the health facility with the health insurance, it is not all diagnoses or all medications that the health insurance can cater for. There are times you have to do top up. Mostly, even malaria, sometimes you have to do top up. So if you come to the facility and you are like, sincerely, genuinely, I can't pay for the 5 cedis maintenance fee or whatever, then it becomes an issue.
You see, the issue is, for instance, if they are giving you para, they are paying, how much are they paying for para? It's not even up to 2 cedis, but you go to the market, you get para more than 2 cedis. So if I am going to buy from the market 3 cedis, and health insurance is going to give me 2 cedis, if it were you, what will you do? At least you pay the difference. Don't you pay the difference? Health insurance is paying 2 cedis. I bought the thing 3 cedis with that markup. So at least we have to pay the difference of the 1 cedi so that the facility can run. You see, health insurance is not doing us any good. The issue is that they take about 5 years to review their checklist. Meanwhile, from day to day, things are being increased in Ghana. So if you tell me that health insurance is HR, if somebody comes to the hospital, don't take any money from the person, and then now person say you go hospital, no, because at the end of the day, I will not get money to even buy anything, so it will not work for us. So that one there, the difference you should pay.
Not only the health sector, because I could remember once I was listening to the radio, and even this assembly, they were talking about some security personnel and all those things that they be paying them themselves, not from the government. So it applies to most of the institutions or organizations. Yeah.
What is the link between the Ministry of Health and then the Ghana Health Service? Is there a direct link?
All right, thank you very much. With the Ministry of Health and Ghana Health Service, like you rightly said, Ministry of Health formulates the policies, and then the Ghana Health Service implements the policies. They implement the policies through other regional health directorate to the municipal district health directorate, then as well as the various health facilities. So it's like Ministry of Health is the boss, then Ghana Health Service is the more or less the subordinate or an agency under the Ministry of Health. So whatever policies they formulate, they give it to Ghana Health Service as well as other agencies to implement in Ghana.
Unfortunately, I saw my auntie's name in one of the lists. And my auntie too is not a disability person. It's not a disability person. So for me to know that day, in fact, I got angry. So for me to know that truly it's my auntie's name, when they were going on field, I was not supposed to be part. But I told my boss that, oh, it has been a long time I visited this place, so I want to go. And unfortunately, the first house they entered was my auntie's house. And they gave my auntie, if I remember 2015, they gave my auntie 500 cedis. And do you know the amount written in the actual form? It was supposed to be 2,800. That way, so you can imagine. Is it a month or a year? That one is the whole year. The one on the form that we took there was supposed to be 2,800 there. But the actual money they gave to my auntie, who is not a disability. Yeah, it's a disability. So after she took the money, we got to the office, we do the distribution. When we got there, I asked the social welfare in charge that, do you think the way we are distributing the thing, is it right? And from then, they packed my things from social welfare office to works department. So you see, it's all bank back to accountability.
Is there a reporting mechanism? If I come to you and then you as a beautiful nurse, you didn't do me well, how do I report you?
Oh, you can go and report me to my in charge, or you can go to the administrator. But I'm not sure.
Anything will be done about it?
Oh, something will be done about it. Just that the client will prefer facing you, like telling you his or her mind, than going to report. So it's not something we really encounter. But we are doing our best as healthcare providers not to fight with our clients. So the reporting there is not happening.
But apart from no, aware ake assembly sani ame release Chicago Kenya hospital say.
Sana.
Shami
Sana.
Kame loko ye ni follow up ye.
Ado loabili.
Maybe ake she ni onipa ejije be sani nyonye like nye tishi nye kwe ake ni biji nye.
Kono ko demo problem o. Loko manyima ya hane. Said no domo. How can
we obey information? Look by you okay.
Yes.
Kesi vote na se be me. Kwa biya. Eke ni menye tesi o. Ka gen ka gba siga me ame. Ka ma vote ka o ka vote. Ne ka ba da no hu. Atu no fe ba ye leki.
Firestone.
Firestone. Blow chop me twa. And you no go chu.
The case shikane ebaba akeha woka release shikani e share nye die alo e share mambia de alo e share hospital amede what offend won lose
MC ke MC ke minister the MP ejiadim I was coming kaba na ke toblo
MP Nenale.
Oh, Ange.
At times, even the MPs and the MCs have been fighting over this money.
The money that are supposed to be used for people. Mr. Amin, there's no money released to the hospitals.
Not at all.
It's like 0.00.
The government have something like we call a seed money to the hospital so that you start with your operation. But then this particular hospital that we resume, there was nothing like seed money, not even a peswa. So it is the
only thing they gave us was an ambulance.
Yes, and the ambulance is even part of the construction, like the whole deal.
Are we new to vaccines in Ghana? No. Since our childhood, everybody took. COVID is new, but we are not new to vaccines. Yes. The same way you produce any other vaccine is the same way COVID-19 vaccine is also produced.
This week we are doing the national COVID vaccination.
Yay! I'm excited. Are you not excited? I'm excited.
So, like I was saying, we started Wednesday.
Like we are saying.
We started Wednesday, and then the program will be ending on Sunday. And then the vaccines, we have different type of it. We have J&J, we have AstraZeneca, we have Pfizer, we have Moderna, and then Sputnik V. But currently, we only have J&J, and that is what we are working with. And then there are durages, time frame for which you have to take the vaccines. When you take J&J, it is a single dose. After 3 months' time, that is only when you are eligible to take the booster. You can take it after 3 months, but not before the 3 months. Please, let's be clear on this. If you take AstraZeneca, Pfizer, and then Moderna, after a month's time, you can take the second dose. And then after taking the second dose, 3 months' time from the second dose, you can take the booster dose. So for Pfizer, Moderna, AstraZeneca, you have to take it 3 times. But for J&J, you take it 2. First dose and then booster dose after 3 months' time. But for AstraZeneca, first dose, second dose, 3 months' time, you take the booster dose. And it is working. It is working. Some of you have been vaccinated against Hep B. I know Hep B is part of your program. Yes. How many doses did you take? 3.
Let me not cut
Just
you.
now, I was coming from the community. Somebody said the money I took from the president before coming to do the vaccination, I should give him his share before he take the job.
True. So we have the routine vaccines we take for all our children. So the 6 killer disease, and when you are, like you said, when you are pregnant, you're supposed to be taking some jabs and all that. All those ones are the routine vaccines that we are all aware of. We have vaccines we give for hepatitis A and B. We have yellow fever. We have meningitis. We have HPV, malaria, tetanus, and now we have COVID. As you can see, all of them are checked. That means that everybody is comfortable with all of them, except COVID. Please, I beg you, as we are going out there, especially as health workers, we should please and please and please know that whatever we are doing, we need to make sure that we ourselves, we are safe. And if you are safe, then you wouldn't be carrying, like you said, diseases to your family members in the house, like that thing that happened with the baby and their mother. So thank you all for coming today.